All right, welcome to another YouTube video here at Mission Move. Today we are going to talk about some stuff for golfers. So Dr. Courtney here does a lot of TPI stuff. There we go. Does a lot of TPI stuff with some of our golfing clients, patients here at Mission Move. And we were talking and she was like, this is a problem that they all have. I seem to be always having to do some of these common corrections for the certain assessment that she does. So tell us about that. And then she's going to take me through it and we'll show you what to do.
Yeah, so one of the most common things I've been seeing as a theme of issues is what we call dissociation, meaning being able to isolate your upper body and your lower body. Now you might be thinking, what does that have to do with golf? Well, in the golf swing, we obviously don't swing as an entire unit. There's different sequences to the pattern of the movement. So in your downswing, your hips are coming first, then your trunk, arms, club. So if you can't disassociate lower body versus upper body, it actually can impair some of the parts of your swing, make it less efficient. We want to really be able to have that freedom of movement with your lower body and your upper body to get more power at the end of the day. You want to get a better swing, you want to get more power, you want to drive the ball more. So this is going to help you with that. So one of the assessments that we do in the TPI is to screen, if you can, separate your upper and lower body. So Joel is going to go ahead and assume the position. So you're going to pretend like you're at address. Yep. From that position, go ahead and cross your arms across your chest. And from here, without giving you any cues or anything, I want you to rotate your upper body to the right towards your backswing as far as you can. Good. Come down, and then you'll go towards your downswing. He's actually doing it pretty good. Now do it a little bit quicker. So what I'm looking for is he able to move his upper body in relation to his lower body, or both of them moving? He's actually doing it really good. Now show me a bad one.
So a bad one.
So everything's kind of all moving together.
Yeah, bad one would be more.
Yeah, so you would have more difficulty. All right, so we've looked at the upper, now we want to look at the lower. So from this position, you're going to go into the same position at address, and now you're going to hold your upper body stable, and you're going to try to move just your hips. So Joel's going to work to move just his hips all the way through without moving his upper body.
Not easy, not easy.
Not easy, it's hard. So he's moving a little bit.
Yep, it's hard not to like just
want to swing everything kind of together. But again, you want to be able to separate and really isolate through there. Yeah, show him. Shakira, Shakira. Good. So those are two assessments, and you can use those as correction drills as well. So if you find that you have difficulty doing this one, go ahead and practice it a few times. You can do it before you go out into the range. You can use it as like a movement snack throughout the day, or you can also do some corrective drills like the ones we're about to show you. So for the upper body, so if you have difficulty maintaining lower body stability and difficulty rotating through here, we're going to come over to the wall and do what we call half kneeling rotation. So you're going to set yourself up against the wall. You can put a yoga block, a ball, a big pillow, squish it up in half. So essentially this one is staying stable. You're pushing that into the wall. Arms come up, and then he's going to rotate behind him. Wow, very nice. And then come back. So lower body staying stable in that position, and then he's rotating through that thoracic spine, being able to actively move through that range of motion. And obviously he would do both sides, so he would turn around, other leg in front, and then doing it that way. So that's a really good drill to be able to isolate that upper body while maintaining stability in the lower. Then we've also got another one you can do. So you can take your golf club or PVC piping. He's going to be kneeling on the ground. Oh, sorry. What am I doing? You're doing it.
Okay. Yeah.
I was about to demonstrate it. No, I'll have him do it. So he's going to put it behind his back, actually. Yep.
Like this way?
Yep, right through there. So lower body staying stable. From here, now he's going to rotate to the right into his backswing as far as he can. Keep your hips pointed forward. And then come back to the center. And then go back into your downswing. There you go. And again, just working through that range of motion there, being able to really isolate with everything kind of not moving all as one.
Yeah, this being in the half kneel locks your hips a little bit more than they would be in standing.
Mm-hmm.
Yeah.
Good.
Okay.
All right, you can come on out.
All right.
Then, if we're having some issues with lower body movements, we're going to have to stabilize the upper body and then isolate the lower. So, again, with your golf club over your PVC piping, broom, whatever, you're going to hold it out in front of you, and that's going to be your support for stabilizing through here. And you're going to go ahead and do your rotation. So you can take it slow initially, and then you can start going a little bit quicker once you get more comfortable, and then make it like an actual downswing into your backswing to downswing. Good.
Yeah.
So those are some drills through there. And then our last one, we're going to do up against the wall again. So these are called hip cars.
Okay. Yeah.
So what he's going to do, he's going to push into the wall, so from here, and we're going to lift your leg up, trying to isolate that upper body, and then rotating, to this half kneeling position, and then back. And you're going to alternate back and forth. So lift it up a little bit more, get it up there instead of just sweeping it around. Lift it up and over. There you go.
All right.
That was
It's a little hard on my knees.
Oh, sorry. You can put a foam pad or something underneath there. He's making excuses. All right, so those are a couple of corrective exercises and one test you can use to look at your separation patterns from your upper and lower body to see if that will help your swing and hopefully generate a little bit more power if you're able to really get through it.
Yeah. Dissociation?
Dissociation is the technical term,
Yes,
but it's kind of
yes.
hard to say. So.
Yeah, exactly. So, well, anyway, if you're a golfer, try those drills out. See if you can get those hips and trunk moving separately. Dance, put on some music. And yeah, let us know if you have any questions in the comments below. Thanks for watching.